Hello, I'm Patricia Henderson with Senior Connection Center, and this is your weekly connection. October is Domestic Violence Awareness Month. According to the National Coalition Against Domestic Violence, 1 in 4 women and 1 in 10 men will experience sexual violence, physical violence, or stalking by an intimate partner. Domestic violence affects all demographics, all geographic areas, and even all ages. Here today to talk with us about domestic violence is Jen Shtab, Coordinated Community Response Trainer at the Spring of Tampa Bay. Jen, thank you for being with us today.
Thank you. It's my pleasure, and we appreciate the opportunity to talk about this really important topic.
Jen, can you tell us a little bit about how domestic violence shows up in relationships?
Absolutely. So, domestic violence really describes physical or sexual violence, stalking, and psychological aggression by a current or former intimate partner or household member. And generally, abusers use a pattern of coercive tactics such as isolation, threats, intimidation, manipulation, and violence to gain and maintain that power and control over victims. They often tell their victims where they can go, who they can see, how they can spend money. In other words, they're controlling their decisions and really limiting their world. Some abusers use their role to financially control a victim. They can also impact a partner's health, their mental health, their well-being, their access to care. And really multiple forms of abuse are usually present at the same time. And it's really also important to note that the fear and the intimidation, they don't have to be happening in the present moment to be effective. We've worked with so many people, Patricia, over the years with survivors who tell us that it's a look or a gesture or a body posture can take them back to some heinous event that may have happened way earlier on in the relationship, and it still keeps them in that state of fear. So abuse shows up in many ways.
Now, often in discussions of domestic violence, older adults are not included in that conversation.
Correct.
Does domestic violence show up differently in older adults?
Domestic violence, as you mentioned, it crosses all lines. And so it most certainly does impact older adults. It doesn't stop at a specific age. It's not something that ages out. And abuse in later life, really, it does come with some unique challenges. While still comprising that financial, the physical, the sexual, and the emotional abuse, here we also see a rise in abandonment and neglect. And perpetrators are people that the victim has an expectation of trust, particularly spouses or intimate partners, their adult children or grandchildren, other family members. And older adults that require assistance with their daily life activities are really at an increased risk of being emotionally abused or neglected, and that financial exploitation that we see so much of, the misuse of another person's, of the money, of property, of their assets for self-gain is something that we see often with domestic violence among our elders. For example, like forced property transfers or coercing a victim to surrender finances or property. And that neglect piece is, again, thinking about somebody's basic needs and the willful deprivation of food, clothing, shelter, medicine, or even personal hygiene. These are all things that we do see with older adults who are survivors of domestic violence as well.
Domestic violence does not stop at age 60.
It does not, and abuse in later life really has devastating impact on victims, and it can result in the loss of independence, security, their life savings, their health, their dignity, and as we know when we simply look at headlines, it can be deadly as well.
Now, there's a great concern among advocates against child abuse, advocates against domestic violence, and advocates against elder abuse regarding the pandemic and the social isolation. Because safer at home may not be safer at home for some people, because
Right.
they may indeed be isolated with their abuser.
Absolutely.
Are the shelters open during COVID-19?
Yes, 100%. Our shelter and services have remained open and available through the entire pandemic. There have been some changes, and initially we did see a reduction in shelter calls for a few months at the onset of quarantine. Recently, numbers have been climbing again, and we've also changed how things are with some of our services, including our shelter. So our capacity is lessened because we want to ensure that we only have one family per room right now, and 2 singles per room to reduce any potential exposures. And we have other precautions in place also. Our participants are wearing masks, and so are all of our staff, and we have extended meal times to give more opportunity to spread out and eat separately at different times. And so 100% we are still running all of our services. Some of them may look a little differently. Some things have gone online, although at this point, much of it is coming back into our new normal.
Are the shelters age-friendly?
That's a great question. You know, we welcome people regardless of age, race, ethnicity, gender, sexual orientation, income, all the things that you mentioned at the outset of our conversation. However, our staff is not able to assist in a medical manner. So that's the main thing that I think an elder would need to be mindful of. For example, we can't administer medicine in our shelter. We can't assist physically with needs. So they need to have the ability to care for themselves when it comes to our shelter. And all of our other services as well serve anybody without regard to any of the silos or the different demographics that we see. Absolutely.
What are some of those services that are provided by the Spring of Tampa Bay?
You know, we actually have a lot of services that people may not be aware of, so I'm thrilled to have the opportunity to talk a little bit about them today. You know, the Spring is one of Florida's 42 certified domestic violence centers that provide comprehensive services to survivors of domestic violence. And one of the services people commonly think of, as we already talked about, when they think about the Spring or domestic violence centers is emergency shelter. And that certainly is one of our largest programs. We have 128 beds for survivors and their children who are in danger because of domestic violence, and they need a safe place to stay. And we also have a lot of services for participants when they're in our shelter. So it goes beyond a safe place to stay. Everyone has an advocate that provides case management services for them. We provide classes in subjects like financial literacy, resume writing, school readiness, stress management, and lots of other topics that are all geared towards wellness and self-sufficiency. Also, all of our children, all the children who come into the shelter are assigned an advocate. One thing people may not realize is that we also have an on-site Hillsborough County Public School, kindergarten through 5th grade. So if it's not safe for the children to attend their school of origin, they can attend class right on site. And that even includes after school programming, tutoring, summer programming like camp, and daycare for as young as 1 and 2 years old. We also created a pet program with partners in the community that will board pets off-site as long as the families are in our shelter. So that's great because sometimes that's a barrier to people leaving if they're concerned about their 4-legged friends or any of their pets at home. We know that often our pets are a target of the abuse as well. And so the idea is to eliminate any barriers to the safety. And then we also have outreach offices both in Tampa and Plant City that serve survivors who maybe are still in the relationship. Maybe they're trying to make the decision of what to do. Maybe they know that right now it's not safe to leave, or perhaps they have left and they don't need shelter. And so through these outreach programs, they also can access the other services mentioned in shelter, like advocacy. Safety planning is a key service that we offer and probably the most critical thing that we do at all stages for an individual and family. Case management, we have support groups and classes through our outreach offices as well. And then we also have 8 full-time attorneys that assist with legal advice and representation around injunctions for protection. We also have Spanish-speaking attorneys available. And so they are specifically day after day advising clients around their rights, the protections that are available, and helping them file for those injunctions for protection if indeed that is the safest and best decision for them. And they'll help our participants to get all the information they need to make that decision for themselves.
That legal advice is so important.
It really is. It really is. You know, people don't understand the options that are available and the protections that are there. And so being able to talk with somebody and process it and get the assistance with these documents that might just feel really overwhelming is critical. Absolutely. And one of my favorite programs is our prevention program. So we also provide teen dating violence curriculum in high schools and colleges and middle schools about healthy versus unhealthy relationships, things that people can be looking for, risk factors, topics like jealousy, things to really get our youth thinking about and considering what a healthy relationship looks like for them. They also, our prevention team of 2 also lead a youth action committee. So we have youth leaders in the community that are also spearheading some of this education and prevention. They plan an annual teen summit each year that brings students and faculty together on these topics to learn and discuss and strategize around teen dating violence. They also offer trainings in the community and to professionals that work with youth. So that prevention piece is also really important. And all of our services can be accessed through our hotline. So we have a 24/7 hotline. We have trained advocates answering the phone any time of day to provide safety planning, resources, screenings for shelter, and all of these services that I just mentioned, Patricia, they're all free, they're all confidential. People don't need to be referred by another agency. They can just pick up the phone and reach out directly for assistance anytime. And that number is 813-24/7-SAFE. So 813-24/7-SAFE is a great way in to access any of our services, as well as if somebody needs to talk any time of day.
That's wonderful. It's so important for people to know that there's help available.
Absolutely.
And would you give us that phone number one more time?
For sure. It's 813-247-SAFE, SAFE.
And we will have that phone number and other websites and resources on an end card at the end of the video for you. Jen, thank you for being here today and giving us such great information.
Oh, it's my pleasure. Thank you for the opportunity.
If you or someone you know is experiencing domestic violence, please reach out for help. The National Domestic Violence Hotline is 1-800-799-SAFE. That's 1-800-799-7233. I'm Patricia Henderson, and this is your Weekly Connection.